Intermittent fasting, but is it safe? We're back with functional medicine expert Dr. Cathleen Gerenger, and joining us as well is Seng Sophia Huot. They're here to tell us more about the effects of intermittent fasting. Welcome, ladies. Good to have you here.
It's great to have us here.
Thank you. So, doctor, let's start with you again. What is intermittent fasting?
Intermittent fasting actually it became popular about 10 plus years ago by a doctor named Dr. Jason Fung. And his theory is that if we fast for about 16 hours and just eat in that 8 hours window, our body's able to go in there and burn fat.
And I know it's gained a lot of traction recently. People on TikTok swear by it. Is it safe?
It really depends on the individual, and that's why we want to talk a little bit about how it affects our adrenal health and our thyroid health.
All right, so let's start there. How does it affect, let's say, your adrenal health?
Sometimes when we're under what we call stress or adrenal fatigue, our body dumps out what we call cortisol, and cortisol is our fight or flight response. And what happens is that when the cortisol gets too high, you become what we call insulin resistance. So even though you're doing this fasting, the scale won't move.
The scale won't move. So what does that mean?
That means that sometimes patients can come back and complain about more fatigue. They can complain about their being a little bit more dehydrated. The signs and symptoms are like headaches, dizziness, mental fog.
So dehydration is one symptom. Sophia, let's say that somebody is taking a medicine that leads to dehydration or that makes you more prone to dehydration. Should you then avoid intermittent fasting since it can cause dehydration as well?
Yes, it depends. It actually just depends on the patient, like the severity of it. So like we said, intermittent fasting, like you got to keep in mind that when you're not eating, you're decreasing the volume of fluid that you're taking in per day. So it leads to dehydration. So what medications can lead to dehydration? So Lasix. Everybody's pretty familiar with Lasix. The generic name is furosemide. So that class of drug makes you prone for dehydration already. So if you're on that medication, you may not be a good candidate for this practice if you're considering it.
That's an important consideration. Absolutely. All right, so that's the adrenal glands. How does it affect your thyroid?
Sometimes what we notice in the blood chemistry is that their free T3 is low. And what is free T3 in the thyroid? It's our metabolic machine. So sometimes the free T3 gets a little bit low, their metabolism isn't going to be as fast as it needs to be, and we want like a metabolism that's fast so then your body's able to break down the food that you eat.
Exactly right. Well, I take medicine for my thyroid, and I know that you're supposed to take it on an empty stomach, which I don't always do. But if I were to do intermittent fasting, then I would be taking it on an empty stomach. Would that then change my dosage that I would need?
Actually, it's recommended for you to take your thyroid medication on an empty
stomach
because it increases the absorption, and in some cases, it may increase the absorption too much. So with that in consideration, you just have to tell your doctor if you're considering on fasting, then inform your primary care so that way they can take dosing into,
Because they might want to change the dosing, because if you're taking it on an empty stomach versus with food, how you absorb it is what you're saying is going to be different. Right. So the dosage will not be the same necessarily. Okay, so that's a good conversation. So what I'm getting is that you need to talk to your doctor before you just kind of launch on intermittent fasting, yes?
Exactly, depending on your symptoms, depending on what the problem is. And again, getting basic blood work, comprehensive blood work, especially check your cortisol level, check your thyroid level to see where your baseline is at.
And what is a key to doing it safely?
I would say that, again, I'm not against intermittent fasting, but if you have these signs and symptoms already, start out with a 12-hour window instead of a 16-hour window, and then gradually increase it to a 14-hour, then up to a 16-hour.
So a gradual approach.
Yes.
It's more logical, I think.
Yes, way more logical.
Okay, so as far as all these trends, because it's not just intermittent fasting that you see, there are a lot of other weight loss trends on TikTok. Are there red flags that people should look for?
Yes, especially the ketogenic diet. I see that all the time. And when I look at the patient's blood chemistry, even though they tell me that they're not on a ketogenic diet or they forgot to tell me that they're on a ketogenic diet, I would look at their blood and I'll notice their kidney enzymes are a little bit off.
Oh no.
Yes.
You're telling me that keto causes your kidney enzyme to be off?
Sometimes it does if it's long term. And again, it's breaking that fast or incorporating that glucose back into your body. It takes a lot of work because your body is chemistry. It has to be like balanced in order for your body to be healthy. It's a healthy journey that we want you to be on.
So maybe it's about not doing anything too drastic as well?
Yes,
right?
Absolutely.
Because with keto, if you eat only protein and you eat only cheese and you only eat bad fats, I can see how that might help you lose weight, but maybe it's not optimum health.
No, what's going on with your endothelial cells, your blood cells, your liver enzymes? I mean, there's a bigger picture.
Right. Thank you so much for your insight, ladies. Really appreciate it today.